Osteoarthritis, wear out at the base of the thumb, is a common condition in middle-aged women, characterized by pain, swelling, and weakness when making a pinch between the thumb and index fingers. Two bones at the base of the thumb lose their cartilaginous envelope throughout time, ending in bone-on-bone contact, which causes significant pain and functional limitation. Surgery for this condition is aimed to eliminate such bone-on-bone by removing the diseased bone, trapezium, from the wrist. Once this bone has been removed from the wrist, a suspension has to be created between the thumb and index fingers. The empty space created by the excision of that bone fills up with blood, which will scar down in time, preventing shifting back of the thumb. A novel, minimally invasive technique using the miniTightRope, a construct with 2 stainless steel buttons and 2 strands of high-strength suture, fiber wire, to achieve such a suspension is explained with detail here. First, a skin incision is placed at the base of the thumb to expose and remove the diseased bone, trapezium. A second skin incision is placed between the index and long fingers at the upper portion of the hand. A metal guide wire is driven under power from the thumb to the index finger. The guide wire has also a metal loop in one end to allow the passage of the 2 strands of suture across both bones. The final construct is secured with a stainless steel button on the thumb and index fingers. The skin incision are then irrigated with saline solution and stitched up. The hand is placed in a splint, protecting the operated thumb.